Hi, I'm Dr. Joanette, and I'm an ER physician. I'm also a longevity specialist, and today we are going to talk about one of the most hyped drugs in anti-aging, Metformin. It's cheap, and it's been around for decades, and now people are asking, can it really slow aging, even if you don't have diabetes? So let's dig into the science. Also the hype and what you need to know before you jump on that metformin train. Metformin is a drug that has been used since the 1950s to treat type 2 diabetes. It helps lower your blood sugar by improving how our body uses insulin. It's one of the most prescribed medicines worldwide, and it is considered to be very, very safe. But here's where it gets interesting. Over the last decade, researchers noticed something surprising. They did several large studies, and people with type 2 diabetes that were taking metformin were living longer than the people with type 2 diabetes who didn't take metformin at all. How is that possible? Let's take a closer look at those studies. Here's the big promise: metformin for longevity. One big meta-analysis found that diabetics on metformin had a 7% lower risk of death than healthy non-diabetic individuals. But even more impressive, compared to diabetics taking other drugs, those on metformin had a 28% lower risk of dying from all causes. There was another study out of the United Kingdom, and it found that overweight patients who were on metformin had a 36% reduction in all-cause mortality. These were two eye-catching studies, and they point to a possibility that got researchers and also the biohacker crowd all excited. Maybe metformin does more than just control our blood sugar. Maybe it slows aging all by itself. But hold on, before we go there, let's talk about where those numbers actually came from. Here's the problem with the hype. Most of that metformin longevity data came from observational studies. What that means is that the researchers looked at large groups of people over a long time period, but they didn't control for all of the variables. So while it's true that metformin users seem to live longer, we can't say for sure that metformin caused it. Maybe those patients had better health care. Maybe they ate a better diet, or maybe they exercised more or had better access to some other resources. One long-term study out of the Wales that found that metformin users did indeed live longer than non-diabetics, but only for the first few years. And after at year 5, that trend reversed, and the metformin group had shorter survival overall. So, short-term benefit? Possibly. Long-term anti-aging effects? We don't know that for sure yet. If you're finding this helpful and you want more evidence-based health and longevity breakdowns, be sure that you hit that like button. Also, thank you for subscribing and turning on those notifications. I post deep dives just like this every single week, so you will always be ahead of the curve. So now, let's get back to the science. Let's move beyond those observational studies. There are two major clinical trials that may finally answer this question. Does metformin slow aging? First up is the MILES trial. It looked at older adults with prediabetes and found that metformin caused changes in their gene expression, making their cells behave more like younger individuals. It's promising, but these weren't healthy people. They already had metabolic issues, which brings us to the next trial, the TAME trial. TAME stands for Targeting Aging with Metformin. It was the first major randomized controlled trial that is looking at whether metformin can delay age-related diseases in healthy adults. If this trial proves successful, it would be the first time aging is treated like a medical condition. The results, they're still pending. That trial is now in its 10th year. But this could be one of the most groundbreaking medical studies of our time. But let's look at the animal trial. Zoom out and talk about some animal studies. In worms, C. elegans, metformin extended the lifespan, but only in the young worms. In the older ones, it actually shortened it. In mice, the results were mixed. Some studies showed no increase in lifespan with metformin alone, but when metformin was combined with rapamycin, another potential longevity drug, the effect was much stronger. And here's where it got really interesting. In 2023, there was a study published in the magazine Cell, and it tested metformin in monkeys for over 40 months. That would be about 13 human years. Metformin slowed biological aging in key organs, the lungs, the liver, and the kidneys, even the brain's frontal lobe. It also lowered inflammation and activated a NRF2 gene. That is a gene that helps protect our cells from stress. This was such a promising study that it has led to a new 120-person trial to test the same thing in real humans. So, question is, should you be taking metformin? If you're not diabetic, should you take metformin for longevity? If you do have type 2 diabetes, metformin is already probably a standard proven treatment that is effective. It's also very safe, and it may even help you live longer. If you're overweight or have insulin resistance, it may help improve your metabolic health and decrease inflammation in your body. But if you are a healthy, disease-free adult, we really don't have enough evidence to recommend metformin for you just yet. And like all medications, it comes with some risks. It can cause some GI discomfort. It may reduce your vitamin B12 absorption. And it's not the best for people who have kidney disease and kidney issues. So don't just start taking metformin because you heard about it in social media. Work with your doctor who understands both your biology as well as your long-term health goals. We are really living in some incredible and exciting times in medicine. It is a time where we're not just treating disease, we are exploring how to treat aging itself. Metformin is just a piece of that big puzzle, but it's not a miracle drug, and it's definitely not a one-size-fits-all. As the more data comes in, I'm going to be right here to break it all down for you clearly and honestly. So if you're serious about staying healthy, sharp for as long as possible, make sure that you subscribe to this channel and leave me a comment. Have you tried metformin? Are you considering it? And also, thank you for sharing this video with someone who is curious about anti-aging and anti-aging medicine. If you want more guidance on your personal longevity, I have more resources for you at growwithdrjoanette.com. And thank you for watching, joining me today. Remember, stay curious, stay healthy, and always, always keep growing.